Welcome back. More than 22 million infants missed their first dose of measles vaccine, 3 million more than in 2019, the largest annual increase in over 20 years, according to the CDC. Our 9Health expert, Dr. Payal Kohli, joins us to remind us how important vaccinations are. We're talking measles.
I know.
A lot of people put these vaccinations on the back burner in 2020, and now we're starting to see those damaging results. At one point, measles, wasn't it eliminated from the United States? Why are we talking about this again?
Yeah, it absolutely was. In 2000, measles was said to be eliminated, which means we had gone at least 12 months without any evidence of continued transmission. And the reason for that was really the high rates of vaccination that we had in our country. And now with the COVID-19 pandemic, we're seeing a resurgence of measles occurring, which I'll be honest, I've never really treated in my career because it had been such a low rate cases.
Right. How effective is the vaccine?
Well, it works so well. That's why we were able to eliminate it. In fact, 2 doses are 97% effective, and 1 single dose is even 93% effective. So it's even more effective than those COVID vaccines that we have.
Yeah, can you get a booster for it?
You don't even need a booster because if you get that vaccine, especially
You're
those
good
2
to go.
doses, lifelong immunity.
Okay.
So the way that it reacts in your body essentially creates memory immune cells, which are immune cells that remember how to fight it forever.
Yeah.
So even if the antibodies go down, they sort of wake up whenever you see it again and fight it.
So if you missed it, and a lot of people did, as we shared that statistic, what's your advice to those people? Should they go now and get their vaccine?
Absolutely, definitely. Now, of course, you don't want to get it the same day as the COVID vaccine. And one thing to remember about the MMR vaccine, it's a live attenuated vaccine. So you're actually getting a weakened version of the virus. So it works a little different than the messenger RNA and the DNA vaccines that we've been talking about. But get out there, make sure you talk to your kid's pediatrician if they missed their doses. Get them vaccinated right away.
Talk about the impact of not getting your kid vaccinated. Talk about that and how you put others in danger, truly.
Well, you put your child in danger because measles can, of course, be a deadly illness. There can be long-term sequelae of measles, especially sequelae that involve the nervous system. I remember in residency, I had a woman who would have seizures well into her 30s from a childhood case of measles.
Wow.
And then, of course, you're putting everybody else at risk because you're bringing back this infection. But they're hopefully still protected if they're vaccinated.
So long-term effects, as you've seen. And what are the signs and symptoms of measles?
So measles can present actually kind of similarly to COVID-19. Now, if your kid's not been vaccinated, you definitely want to talk to your pediatrician about when you can get them vaccinated. But look out for the 3 C's: cough, conjunctivitis, which is redness in the eyes, and coryza, which is runny nose, and you can also get rash. You can get spots in the throat, but very similar to what we might expect a cold to look like.
Yeah, so you just have to be vigilant, go see your doctor, and get the vaccine. All right, Dr. Kohli, thank you so much.
And we've been in the